World Brain Day. Welcome to our special show. As we all know, the brain is the command and control center of our body. It controls our emotions as well as all of our motor functions. A healthy brain is the key to a healthy body. Though we are aware of this fact, many of us tend to ignore brain health. The World Brain Day theme this year is Brain Health and Disability Leave No One Behind. This focuses on the need to ensure that the benefits of a healthy brain are accessible to everyone in society and no one is left behind in this initiative. Brain disorders affect every age group, ethnicity, gender, socioeconomic status. Increased awareness can lead to early detection and intervention for various brain diseases and disabilities. Many people with neurological disorders or disabilities face discrimination, exclusion, and social marginalization. By raising awareness, we can combat stereotypes, reduce stigma, and promote inclusion and acceptance in society. Today, we have a distinguished group of medical experts, all renowned in neurology, to shed light on this critical topic of brain health. We're joined by Professor Wolfgang Grisselt, President, World Federation of Neurology; Dr. Gagandeep Singh, Professor in Neurology at Dayanand Medical College, Ludhiana, and President of Indian Academy of Neurology; Dr. Chandrasekhar Meshram, a Director and Neurologist, Brain and Mind Institute, Nagpur, and Trustee, World Federation of Neurology; Dr. U. Meenakshi Sundaram, Director of Neurology, SIMS Hospital, Chennai, and Secretary, Indian Academy of Neurology; Professor Debashish Chaudhary, Director, Professor and Head Neurology, GB Pant Institute of Postgraduate Medical Education and Research, New Delhi, and President-elect, Indian Academy of Neurology; Dr. Nirmal Surya, past President of Indian Academy of Neurology and President-elect, Indian Stroke Association; Dr. Lakshmi Narsimhan, a Director, Institute of Neurology, Madras Medical College, Chennai, Treasurer, Indian Academy of Neurology. Dr. Wolfgang Grisselt, if you could tell us, what do you mean when you say disability and how do you view it from the neurological perspective?
Well, thank you very much. And I also want to thank the Indian Academy for doing such a great effort to promote the World Brain Day and to promote brain health and disability. If I speak about disability, it is something that is embedded into the topic of brain health. It can have many components. The components can be motor, they can be sensory, but they can be also transgress into mental, or they can also have neuropsychological aspects. So it's a wide concept. And the important thing is that one thing that we need to do, and that's why we're here, is try to prevent disability. If disability occurs, we try to, let's say, improve it, to rehabilitate it, and rehabilitation is also a big topic for the WHO. And once people recover, or if disability is only transient, then this is fine, but many disabilities progress and become chronic. And it's very important, and I think this is one of the important issues that we as neurologists have to do, is to be able to also take care of chronic and progressive disease. And this is important for many special age groups, like aged people, and it's also important at the end of their life, and I think that's a very important task. My concern is that in many countries, the availability of resources is not always possible. And myself, I come from Austria, which is a rich country according to the north-south distribution. And I just make one example of a person who has something like flail arm syndrome. This is a very rare motor neuron disease. He can move his fingers, but he cannot use the arms. This is a disability that is making him very dependent on everything, but there's practically nothing you can do in the rehabilitation sector, and there is no aids, and there is no possibilities like bionics or prosthesis, because this kind of disability is not in the box. So this is seen from a very rich country, and also here many things are not available. And from these examples, we have to learn to take care of our patients.
Dr. Gagandeep Singh, if you could tell us, what is the status of neurological disability in India, and where do we stand in terms of numbers, and how does it compare with other disorders?
Thank you for that question. I think it's a loaded question. And I would like to mention that India has gone through three important transitions. The first is the population transition. And today, with its population of 142 crores, India stands number one in the list of countries in terms of population. That amounts to nearly 18% of the world's population. The second transition is the epidemiological transition and is related to healthcare. So whereas several decades ago, we would see loads of clinical cases of malaria, tuberculosis, cholera, etc., all infectious disorders, now and for the future, the major burden, disease burden in the country is going to be constituted by non-communicable disorders. And non-communicable disorders in clinical neurology include stroke, Parkinson's disease, epilepsy, headache, including migraine. The third transition is the neurological transition. And the proportion of neurological disorders constituting the burden of disease in India has doubled from 4% in 1980 to 8.2% in 2020. And this is a huge jump. And this is on the basis of studies done by the India State Level Disease Burden Initiative, supported by the Indian Council of Medical Research and the Institute of Health Metrics in Seattle. Now, just to give you an example, there are 50 million people with epilepsy in the world. 12 million, that is almost 1/4 of them, live in India. And to treat them, whereas in countries in Europe, there is almost one neurologist per 10,000 population. In India, there is one neurologist per 300,000 population. Things are improving. There are many more training positions in neurology available thanks to steps taken by the government of India. But still, I would like to say that there are miles and miles to go before we can sleep.
Dr. Chandrasekhar Meshram, if you could tell us about one particular disorder, that's dementia. Do you consider it a disability, and what are the numbers like in India?
Dementia is a broad term for conditions that occur when brain does not function properly and cause problems with memory, thinking, behavior, and emotion. Alzheimer's disease is the most common type of dementia. Dementia is now recognized as the most important health crisis and disability of 21st century. And why so? Because every 3 seconds, someone in the world develops dementia. There are about 55 million people with dementia in the world. In India, around 9 million people live with dementia. 7.5% of those above 60 years of age suffer from dementia. And in the next 10 years, cases of dementia will double. It is more common in women. Memory loss that affects day-to-day life, difficulty performing familiar tasks, problems with language, and loss of orientation about time, place, and person are common manifestations of dementia. Person may withdraw from social activities, may have mood changes. Condition of the patient deteriorates day by day. Unfortunately, at the present, there are no medicines to cure Alzheimer's disease, but with medicines, some of the symptoms can be helped. But some types of dementia, like dementia due to vitamin B12 deficiency and dementia due to hypothyroidism, can be cured by medicines. Diet plays an important role in dementia. People who take high carbohydrate diet, sugar in all forms, junk food, packaged food, cold drinks have more chance of developing dementia. Physical and mental exercises are important for brain health. Abstinence from tobacco, smoking, alcohol, proper treatment of diabetes and hypertension, learning new things, developing hobbies, taking interest in social activities are important aspects to preserve memory and prevent dementia.
All right, thank you for that. Now, Dr. Meenakshi Sundaram, what about a stroke? Is it an issue in the country, and how many stroke patients are then disabled?
Stroke, as we all are aware, is due to a disruption in blood supply to the brain. You can have a cutoff of the blood supply called ischemic stroke, or there can be bleed inside the brain, which is called a hemorrhagic stroke. Now, all the treatment in stroke occurs immediately, and once that phase, if somebody is unfortunate enough to not report to a hospital within the immediate hours of a stroke, up to 4.5 hours, maybe even up to 24 in some instances, then all we are left with is disability to handle. And this is now rehabilitation all the way. Now, stroke is fourth leading cause of death and about fifth leading cause of disability. There are about, in India, how common is it? What's the incidence? Now, let me put this, it's very stunning to know that there are about 15 to 20 lakh strokes that occur in India in a year, which means a stroke every 15 to 30 or 40 seconds in the country. And every 4 minutes, somebody is going to lose his life due to stroke. And that's how important the burden is. When a stroke happens, 2/3 can be left disabled and 1/3 can lose their life. Now, there is a study called the Global Disease Burden. And when they looked at the burden of stroke in the whole world, it was noted that 70% of the stroke incidents is borne by India. And 70% of stroke deaths occurred in India. This is huge. So loss of life and the significant disability, people who are becoming paralyzed on one side, both sides, all four limbs, inability to talk, to see, to speak properly, or to be on their own. That's what everybody aims for in life. So it's very important to know, especially in the background of recent studies which have shown that even 1/3 of these strokes can occur in ages less than 20 years. So it's a very, very important part.
Dr. Chaudhary, can disability be prevented, and what preventive measures can be adopted at a policy level?
Yes, disability, especially the neurological disability, can definitely be prevented. The preventive strategy would be first to prevent the neurological disease itself. That is the primary prevention, we call it, right? And so if you have the right kind of checkups, right kind of exercises, good lifestyle, take care of all your risk factors, then the disease will probably not occur. And that is called the primary prevention. And therefore, the disability will not result. But unfortunately, many people will not be able to follow it, and some people will have the neurological diseases. And there, the disability can be prevented by doing an early intervention. Like, for example, in stroke, if you thrombolize, you can prevent the disability very well. If you treat a migraine very well, then you can actually affect the disability very well. So these are called the secondary preventions when the disease has already occurred. And secondly, also we need to build up the lot of rehabilitation services in our country. And by that, we can improve whatever the functional deficits the patients have because of the neurological illnesses, and their life and quality of life will become much better.
Now, Dr. Nirmal Surya, if you could tell our viewers, what are the measures to combat neurological disability and what is the current status in India?
So if we look at the most common neurological disability, in India, the commonest three are road traffic accident, that is number one, followed by the dementia as number two, and then third is the stroke. And if you look at the total number of disability, neurological disability, I'm not talking about the total number of accident or injury or neurological insult, 1.5 to 1.7 million patients per year are affected by TBI. And if you look at all these three disorders, that is TBI, stroke, and dementia, 3.5 million people with neurological disability are there every year. This is about the adult and if you look at children alone, you have the cerebral palsy accounting about 2% or 2 per 100 per 1,000 patients, and autistic disorder and intellectual disability giving rise to about 1.25 to 2%. So if we look at various neurological disability, in children, they will be different as compared to the adult. And mind you, I'm not talking about the epilepsy, Parkinson's disease, multiple sclerosis, and other neurological illness, which also contribute significantly towards the neurological disability in India.
Dr. Lakshmi Narasimhan, how can we prioritize rehabilitation in India?
The prioritization of rehabilitation in India, the essence is the brain has a lot of space where the programs can be remapped. This is the basic principle of neurorehabilitation, the neuroplasticity and sufficient space that any program can be remapped in the brain in an already insulted brain. So in India, the team of neurologists, neurorehabilitation specialists, the neurotherapists, and the technical engineers have come to join hands so that the strengthening and more the neurorehabilitation should be all in a more structured and organized manner. The conglomerate of government and the private sector is absolutely essential, and joining hands of the neurologists with the technical people, the technical neurorehab engineers, is absolutely essential. The rehabilitation includes the locomotor rehabilitation like assistive devices, and the exosuits, exoskeletons have to be indigenously manufactured and will be of immense use. Coming to the sensory rehabilitation, the various sensory rehabilitation modalities like cochlear implants for hearing, the retinal implants for vision, the sensory substitution devices, all will tremendously improve the quality of life. Most important, as our population becoming more and more aged, the cognitive rehabilitation is extremely important. There are memory glasses, there are the spatial orientation maps, there are falls detectors which alarm you before a fall. There are cognitive orthoses which help you in activities of daily living, especially for the old people who are demented. The cognitive rehabilitation, as the artificial intelligence, the virtual reality are going to play a very major role in the cognitive rehabilitation of our country. As we keep progressing, the neurorehabilitation sector is a very, very emerging sector, requires strengthening from all these teams.
Well, with that, time for us to slip into a short break, but the discussion will continue on the other side. Stay with us. Finally, I'd like to ask you, please provide some simple tips in the form of one-line messages to the general public to improve the brain health and prevent disability.
Medically, I think it's important to mind the nutrition, the food intake, to avoid diabetes, and most important, to keep an eye on the blood pressure regularly. Not medically and not evidence proven is, I think, you should do regular exercise. You should take care of your body image and avoid being overweight.
Dr. Singh, your one-line message?
So we really need to focus on prevention and prevention of brain disorders and disability associated with them. And one point I would like to make is that we can do a lot by remaining mentally active in terms of preventing neurological disorders like dementia. Simple things like playing a game of chess twice a week or solving a crossword puzzle daily, remaining socially active. The more active we remain mentally, the less likely is our brain to suffer from various forms of disability.
Thank you for that. Dr. Meshra?
Yes, there are three pillars of brain health: exercise, both physical and mental, balanced diet, and good sleep. We need to give attention to these factors to keep our brain healthy and prevent diseases.
Dr. Meenakshi Sundaram, your one-line message on World Brain Day.
On the occasion of World Brain Day, I would like to tell people that, at any stage of any neurological illness, never lose hope. There might always be a way in which your quality of life can be improved. The Indian Academy of Neurology does not definitely want to leave anybody with disability behind.
Dr. Chaudhary?
So brain is the most important asset of your body. It is the most important and the master organ controlling your body and mind. Nurture it, protect it, The more you use it, the more dividends it will give.
Dr. Nirmal Surya.
The best is to prevent the neurological disorder. So you take all the care so that you don't get any of the neurological issue. But if it is not possible, then early treatment and detection to minimize the neurological disability. But in spite of all your effort, if still there is a neurological disability, mind you, the neuro-rehabilitation with the team of physiotherapy, speech therapy, occupation therapy, speech and language therapy, and cognitive therapy can make you back to the normal or near normal. So please avoid the disability, number one, and if it is there, take a proper rehabilitation program. Thank you.
Right. Dr. Narasimhan?
I request all the viewers to be physically active and happy, cognitively active and happy, spiritually active and happy.
And that brings us to the end of the show, where we've been talking about the very important issue of brain health. Thank you, doctors, for joining us on the program. Thank you all for watching.